All right, I think that's my cue. Hi, everyone. I am Nick Greenhalgh, Associate Editor with Colorado Inno. Welcome to our State of Innovation event. As you can hear, my dog just started barking in the background because she knew it was go time. Before we get going here, and we'll give some people time to jump on in, I just wanted to give a brief intro on who we are, and I'll intro our panelists as well at the end. For those who are unfamiliar with us and what we do, Inno is part of a growing network of sites, currently in 14 markets across the country, and we're committed to covering and connecting the local technology, startup, growth, and innovation scene. Through a daily email newsletter, stories, monthly events, which have now gone virtual, as you can see, directories, data, and more, we're building a portal for the region's startup and tech communities. You can find everything you need from us at coloradoinno.com. And I encourage you to please sign up for The Beat. It's our daily newsletter. It is the absolute best way to stay plugged into everything that's impacting the local innovation economy. And it's the best way to keep in touch with us, to know what we're up to, what events we're hosting, what stories we're writing. That's where you want to be. You'll get that news, you'll get analysis, as well as info on other events and job openings, and a lot more in a very conversational manner. Since we launched here in September of 2018, yes, we're approaching our second birthday. We've written more than 500 total stories and sent out just about as many newsletters. So we've been around, we've been covering the ecosystem, and we're looking forward to continuing to do so as we move forward here. With that, and it looks like people are still streaming in, just for attendees, you're all on mute. We can't see you. If you have questions, there is a question box that you can type your questions into. We've got about 45 minutes or so here of panel talk, and then we'll open that up to audience Q&A for the last 10 minutes or so. So if you've got questions, pop them in there. We'll be monitoring that throughout, and we'll swing back at the end and hit some before we log out. I think that's everything I've got on my end. So let's get into the event here, and we'll intro our panelists. So this is Colorado Inno's first virtual State of Innovation, focused specifically on crisis innovators. When the COVID-19 pandemic hit here, specifically in Colorado, the state turned to local tech and startup leaders to develop solutions to slow and track the virus. Here today, we'll be chatting with the leader of the state's innovation response team, Sarah Tuneberg of Geospiza. Hello, Sarah. And a member of the task force, Brad Feld of Foundry Group. Hello, Brad. About their experience, their goals, and what's next on their end. So a little bit of background on both of them, and then I'll let them introduce themselves as well. So Sarah, as I mentioned, is the CEO and co-founder of Denver's Geospiza, an emergency management software startup, and also the lead of the state's innovation response team. Brad is the co-founder of Techstars, managing director of Foundry Group, and a member of the state's team as well. Today is also a very busy day for Brad, as he just released his newest book, The Startup Community Way, so check that out as well. Thank you both for coming on today. And if there's anything else I didn't hit, please feel free to introduce yourself, add anything I didn't get to. But hello, Sarah and Brad.
Howdy.
Hi, thanks for having us.
Absolutely. Thank you both for coming. I know you're both busy. Unless there's anything on your end, I'm ready to jump into some questions here. So first off here, let's step back a few months. When did the state first approach you guys to be part of its response to COVID, and what was your initial reaction? Brad, why don't you kick us off?
Sure. The dates that stick in my mind also are linked to my realization of what was going on and the seriousness of it. On March 11th was the first day that I essentially sheltered in place. So I really haven't left my house since March 11th, only a couple of times. And that was a day that Brian Leach and Rachel Carlson, Brian from Ibotta and Rachel from Guild Education effectively convened a group of 30 or 40 Denver and Boulder-based tech leaders, entrepreneurs, but people sort of CEOs of various companies that many people around here would know the name, or listening would know the names of. And on that call, we spent probably an hour and a half that morning going around the horn talking about COVID and what people were starting to think about, because the idea of work from home, the disease and the pandemic starting to spread in a meaningful way, not just in Seattle and New York, but in other parts of the country. They were starting to become cases in Colorado, and there was a lot of like unclear on our part exactly what was going on, because in New York, of course, by this point things were falling over pretty quickly, and on the West Coast, where, for example, we have a Foundry, maybe a half a dozen companies in Seattle, all of those companies were working from home, and so this wave was happening, and we're, as a business community, entrepreneurial community, trying to get our arms around what was actually going on. So that then generated a statement later in that week. Many of the companies on the call decided to shift to work from home voluntarily. We put out a statement from, I don't remember what we called it, but Colorado tech leaders saying, if you can work from home, work from home. That weekend, Jared Polis reached out to me. I've known Jared for many years. He's one of the first people I met when I moved to Colorado, when he was just entrepreneur in his second company, actually, but just starting to get BlueMountainArts.com off the ground. And the reach out was, this is he had a very clear view. This is a crisis. This is going to be a crisis. It's going to move very quickly. We have a lot of things we have to do at the state level, and there's a lot of stuff going on that we know we're not going to be able to address because we either don't have the resources or the frame of reference or the infrastructure to address it in the midst of what is an evolving crisis. And the request was, hey, Brad, can you get some friends and colleagues to jump in and help? And the answer, the question of help in what way was like, don't know. Like, we're going to be figuring this out as we go, really quickly as it unfolds. And I said, yeah. So that was kind of my introduction on that side, which is the part that ended up becoming the innovation response team that Sarah runs. The other thing that happened in parallel was two other reach outs happened from the state. One was for a fund that got created that is the governor's COVID relief fund. But Rick Sapkin and then a small team reached out to me and a few other people and said, hey, will you help us put together this relief fund? Like, we think we're going to need to raise a bunch of money for COVID relief, from the private sector. Can you help? So I got involved in that. That fund has ended up, deploying about 20 million bucks and was incredibly impactful very early on with some of the relief efforts. And then the last was Betsy Markey and her team reached out and put together an economic, I think the title of it is the Economic Stabilization and Growth Council, of which there's about 7 different committee heads. Federico Pena ended up chairing it. And I led the businesses under 500 people across the state. And so sort of multiple things happening at the same time, economic and health at the front end of this, not doing work for the government. That wasn't the goal at all. The government was, the state government was doing its thing. It was mobilizing and organizing resources from the private sector who all, like, everybody wanted to help, like, this crisis, like, we're Coloradans, we want to help each other. And in the mode of that moment, a lot of people, of course, come at whoever they know in the state and say, what do I do to help? And, everybody in the state's like, I'm working 18 hours a day just trying to keep people from dying. So we ended up creating several vehicles that allowed a bunch of volunteers to engage in meaningful ways that either had real impact on things the state needed that they didn't have the resources for, or frankly got in the way of a bunch of noise that otherwise would have been incredibly distracting to the state, because people in the state would have ended up spending a bunch of time on that stuff. So that's my involvement. Sarah can talk about hers and also her onboarding, because I think that's part of sort of the dynamic of the private sector, but then engaging with the state in a way that was constructive and worked for the state.
Yeah, absolutely. And I think one of the things that really stands out about that, so I am a longtime emergency manager. I am a public health emergency manager who also is an entrepreneur and has set up tech companies. So I have this sort of very weird and unique experience where it's like my whole life was built for this moment. Um, and in emergency management, we always call the second disaster of disaster the challenge of volunteers and donations. That it's incredibly powerful when a community is down as a result of a disaster. The amount of people who want to do something and the amount of resources that become available, and just harnessing that power in a way that is productive and that doesn't bog down the official response is incredibly difficult. So I think that that's an important thing that the work that Brad did and that Betsy Markey put into motion and all of these people put into motion really freed up a lot of state capacity to do the official response. And it was an incredibly powerful sort of blocking and tackling that happened that you can't underestimate the power of. But for me, my entry into this role was fast and furious, and I am incredibly grateful for that. But I, again, deep experience in emergency management and government and public health, but did get a call. I don't know who called me first, but it very quickly I had an email introduction that was like Brad Feld, Jared Polis, which if you're a person in Colorado, you're like, whoa, how's this happening to me on a Sunday morning? I was making waffles for my 3 children in my pajamas, and the next thing I knew it was, can you be at the EOC in 90 minutes? And I was like, sure, I can definitely do that. Like, got to take a shower. Oh my God. And was then really generously incorporated into the official response, which is an appropriate thing for me to do. I have all the training, I have all the background. And so I was able and given a role to lead the innovation response team. And we had 5 primary areas of charge, which included scaling up mass testing, so executing the strategy that the state had developed at scale. So really a good thing for a tech CEO to be doing, right? We know how to scale things. I'm really incredibly grateful for Brad and all the expertise on how you do that. Also enabling isolation and quarantine supports. So recognizing that it's incredibly difficult, as we've all now experienced, I hope, to be home for a long period of time. And when people test positive for COVID, we ask them, or when they get tested for COVID, and then especially when they test positive, we ask them to stay home for up to 2 weeks. And if you are a low wage worker, or you live in a high density family environment, or you even have a dog that you need to walk, it's incredibly difficult for you to do that. So we were also charged with creating a series of supports, both joyful supports and high acuity supports, to help people stay home safely and healthfully. Also working on the procurement of constrained critical supplies, which is a problem that is not gone, but the tenor and the scale of the problem has changed. And I think that this is another one of incredible power of the private sector and the power of partnership, because the supply chains broke. We have a just-in-time global supply chain for just about everything. We don't have any excess capacity anywhere. And all of a sudden we had a global pandemic where everybody in the entire world needed the same things: N95 masks, gowns, gloves, ventilators. Everyone in the entire world needed it, and it just completely broke the system. And at the same time that happened, everybody who you've ever met's frat brother or real brother knew somebody who could get you that thing.
Yeah,
And
the number of people I now know who know someone who knows someone who can get me 1,095 masks is a very long list.
it's a big number. And so this innovation response team, we were able to partner with the private sector who understood manufacturing, who understood what the difference is between a KN95 and an N95 and how you test those, and could get us hooked up with a lab at CSU to test those things. Really, like, that was one of the charge areas, and we did a lot of just filtering through a billion leads. And there was a New York Times front page story about this on the federal level, and they had it even worse. But this was a real problem, and so that was another thing we did. So yeah, we also did a bunch of tech enablement, recognizing that our systems weren't built for a global pandemic of this scale. We had to reinforce a bunch of our data systems and our IT systems to respond to the demand. And also telemedicine, which was a really important thing too. As you're home and isolated from your healthcare delivery system, how can we enable and strengthen those systems so you get those delivered? So those are what we worked on.
Great. And forgive me if I'm muting in between here. My dog has not made a noise in 10 hours. And the moment this started, she's been losing it. So
it's the universal law of
right. It's the charm, right? The charm of working from home, and my home office is my kitchen counter. So, but so this all comes together so quickly. You have all these goals set out for you. How do you prioritize what you need to tackle, and then how do you jump in and start addressing the things you need to address?
Hey,
Brad,
go first.
Yeah, I was gonna say there are a couple of different threads that all happened at the same time, right? Because you have a crisis, and in state government, there's a mechanism and a way to organize and manage around a state crisis, and it's linked to all the local governments. And this was a health crisis, so there's a particular infrastructure for all that stuff that just happens, right? It has nothing to do with anything anybody else would do. And that's not where we engaged. Where we engaged was really understanding, oh, here's a thing here that nobody can get any focus on and attention, or nobody knows anything about, or what if? Like, there's a lot of that kind of stuff at the very beginning. And we quickly created an organizational structure that had a private side and a public side. And that was really important because we were very clear from day one on the private side that we were volunteers, that this was not anything other than we were here to try to help in whatever we could with whatever the state of Colorado needed under their direction. But we weren't going to replace systems. There were no commercial relationships. There was no goal of anything downstream. And it was also a way to, as Sarah mentioned earlier, filter these many, many people who were coming at the state and saying, I want to help, and figuring out what they could do, where they could help, what would be useful, without having the state end up having to triage and manage all of that conversation in the midst of a crisis. So we ended up setting up a couple of different things. One was we functionally separated organization. So Sarah and who ended up working and worked for the state was the innovation response team. So when people hear that phrase, that's a state function. And then there was a group that ultimately I led with a few other people called the Innovation Response Volunteers. And so we created clarity between the idea that we weren't representing the state, we weren't making decisions on behalf of the state. That wasn't our role. So like just, it may sound like a formalism for the sake of formalism, but it was actually really important in terms of getting alignment at the beginning of this crisis, because I don't know, for the first 2 weeks, I'm usually somebody who's reasonably on top of my email, like within 24 or 48 hours. Like, I mean, for 3 or 4 weeks, I mean, in every 10-minute period, more came in than like what from parts unknown. And so just understanding what to do, that was piece one. Piece two is we used a very traditional model for the team, which is a daily stand-up that anybody in technology, and I think probably a lot of people in business understand, but we had a 30-minute stand-up each morning. I actually had 2 each morning. I had one with Sarah and the IRT, which Sarah led, and then one with what we called, what ended up becoming called Energize Colorado, which was the economic group that I put together. So there's a 30-minute team there. That's led now by Wendy Lee, and that's actually an organization that's a new nonprofit called Energize Colorado that is separate from that economic council that was convened. Again, structure matters some to make sure you know who's doing what and who has, essentially the phrase would be decision rights in a business context. And then even within that, then there were heads of each of these areas. So as Sarah talks about it, we had different people who were leading different initiatives. And my goal was to hire CEOs on the volunteer side, bring in CEOs. So each of the person leading each of those initiatives was a CEO. So for example, Noel Ginsberg was essentially the CEO of all the PPE procurement and supply chain stuff. And just a lot of it was, work done that had no outcome, but it was triaging this immense amount of noise that otherwise people within the state government would just get locked in. We, at one point in time, if people remember, we went from, there was probably a, Sarah, 3-week period of ventilator madness, where, we initially needed, like 1,000 ventilators, and then we needed 3,000 ventilators. And I remember there was a press conference that Jared went on and said, based on our models, we might need 10,000 ventilators based on where things are going. And that then, I think, it was either right around the time that he did full stay-at-home order. And like, we don't have 10,000 ICU beds in the state, right? So the sort of like finding one ventilator was hard. If you now look back at the history, all of the ventilators in the world were consumed. The federal government was rerouting all the ventilators that were being purchased to the federal government, which is its own whole wonderful thing. And at the same time, there were huge contracts with a couple of companies, including Honeywell, and I think Ford was in the mix to start making tons of ventilators. And apparently we now have tons of ventilators that nobody needs because we ended up not needing that. But like managing that on a daily basis, I mean, that was all consuming. And so Sarah's job was to direct us in areas that she needed help with and be engaged in those, be the feedback loop within the state. But then within our teams, it wasn't that I was doing all this work. It was that I was trying to then manage a team of CEOs, each who built their own team. So Noel's team, for example, was about 30 people. And he found 30 volunteers, people in the private sector, people that knew manufacturing, people that knew procurement, and they all then went off on their own sort of daily exercise. We created an organization. Another one of the groups is Citizen Software Engineers. We had about 100 volunteer software engineers led by Tim Miller. And they built a bunch of software. None of it was intended to be replacements for state systems. They didn't work on state systems. They didn't use any private data or state data that was not public. What they did was they built some things to do some stuff very, very quickly to help with decision making using publicly available data. And it was stuff that, you could do a software development project for it, but this was a team of like the A+ software developers on the planet who could very, very quickly go and build prototypes and get those prototypes and use those prototypes to help surface, is this interesting data? No, that's not interesting data. Okay, we won't stop. We won't do any more with that. Oh, is that interesting data? Oh, that's really interesting data. Let's do more of that. And so it was managing that kind of activity on a daily basis was how I approached it in conjunction with Sarah, who then had, I think you could turn it around and talk about, for 2 weeks you were in the EOC, and then all of a sudden everybody went home. And that was a whole nother probably challenge.
Yeah, and I think that the thing that it felt like that is one of the most successful and exciting things that came out of the innovation response team and the partnership on the private and the public sector is that it was like classic startup, classic like we are in a state of we're in a pretty dark cave of unknowing. We're not sure exactly what's happening in the world. We're not sure what this virus is. Just for reflection, we're 6 months in, we know so much more. Remember back in March, like none of us knew anything. We still don't know anything, but we definitely didn't know anything then. And it was very hard to even know what we didn't know yet. And so the innovation response team had this very wonderful thing, which was ideating and rapidly prototyping and then killing things that didn't make sense. And so it was a way for people within the state, especially within emergency management and public health and ag and everywhere, to say like, I have an idea, I think it might, or I have a question. Can you help me answer that? Can you help me rapidly ideate this? And then we can decide if it has legs or not. So it's like super classic startup processes. And there is a culture in state government, right? That isn't super oriented around killing ideas. That's hard for anybody to do. But I think especially in a moment of intense stress, you don't want to just say like, nope, not a good idea. Let's move on. Let's rapidly iterate on this thing. And so I think having partners in the private sector and in the tech startup world especially was incredibly powerful to Colorado, because we were able to surface ideas, get support on how to sort of structure them, ask the right questions if it was tech, evaluate the data, see if it told us anything, and then decide if we wanted to proceed forward. And some of those very good ideas have since come back and they live on in the state, but not all of them, because they weren't all good. Not in a bad way, no judgment.
Right, I want to emphasize something Sarah said, because history, we're in the end of July and it's really easy. Human beings are not good at remembering what happened. And so history, especially in near term, is often very confusing, and it's very hard to sort of interpret what happened. And also in this moment, we're still in the middle of a global pandemic. I mean, the COVID crisis is raging on, no matter how much denial people want to have, independent of what people are doing. And there is no like, oh, if you had just done A, B, and C, it would all be better. Like, I mean, there's a lot of things you could have done. One could have done that would be positive, and lots of things that one has done that have been negative across our society. But we're still in the midst of this. So if you time travel back to mid-March to mid-April, and you, with real honesty and real clarity, remember what you knew about COVID and the COVID crisis, and you remember the stresses that you personally had in that moment, and you knew what was, or you could remember what was being communicated, both at a federal level in the media on a daily basis, both positive and negative. If you remember, there was a moment in time where I believe in early April, our president said everything will be open by Easter. And I remember us in one of our daily stand-ups saying, that is just so not helpful. Like that, it's beyond magical thinking. It undermines everything that everybody's trying to get their arms around. And so while it's easy to say, you could do this better, you could do that better, if you'd only done this, if you'd only done that, there was probably a 45-day period. I kind of mark it at the end of April for me, where until the end of April, it was a daily fog. There are lots of cliches around it, like fog of war or whatever cliche you want to use, but it was a function of enormous amount of uncertainty, huge amounts of new information coming daily, lots of very rapid impact of the things that happened. So you do something and it would immediately have a positive or negative impact, or you wouldn't do something and it would immediately have a positive, negative impact, against the backdrop of the entire infrastructure of people working at incredible pay, huge of energy, huge amounts of time, while trying to live their lives in a way that's completely unnatural to them, 24 hours a day in their homes, against the backdrop of, remember, we had 2 or 3 weeks of the stock market falling like this, so probably there was enormous economic uncertainty that everybody was feeling, and what's the government going to do, and then huge unemployment. Like all of these things that were, if you could, be an alien watching it from outer space, you'd kind of say, oh yeah, I see how that's all happening and how it's connected. But when you're in the middle of it, you're just trying to make some sense of it. And I mean, I give Sarah huge amounts of credit for this. On a daily basis, the amount of pressure, not even to just make decisions, but just to handle like all of the different things against the backdrop of the incredible uncertainty we're facing, was really hard. And I think it's easy with the passage of time for people to forget that and to forget where they were in that moment. And I think it's really important to recognize that. And I'll make one other comment, like having interacted with not just Jared, but Betsy Markey, for example, and a number of people in state government during that period of time. I am really proud to be a Coloradan. I am really proud to live in the state, because the clarity of thought against the backdrop of this abject chaos in a situation where nobody had ever experienced it before, and the desire to help each other and the continual commitment to help each other was spectacular. And we've seen it in, there are plenty of states where we've seen that, but there's been plenty of leadership in other states around the country and other countries at the federal level and the national level that has not been, helpful, constructive, thoughtful around the citizens. And it feels good to have been involved in it from that level.
I absolutely feel that as well. I am a Colorado native, though I was gone for a very long time. And When I think about being anywhere in the world in the time of COVID, I guess in the United States, especially in the time of COVID, I'm incredibly grateful and proud to live here. And I think one of the things, to me, there's sort of like two startup mantras that come up for me that are really oriented towards the way we've responded in Colorado. And one is very much ode to Brad and the Techstars universe of Boulder, which is give first and give generously. And I think we saw that in so many different ways in the early days of the craziness, especially where all of these people offered to volunteer, people were donating money, people were also doing a really grassroots effort of helping neighbor to neighbor. One of the sort of like proudest achievements I have, and I will have in all of this, was that we moved first as a state on a masking ask. We didn't move first on a masking order, but as a state, Colorado was the first to encourage public masking or public face coverings. And together with that, we launched the Colorado Mask Project, which was a grassroots effort to get everybody in Colorado a mask within, I want to say it was within 16 or 18 days. And it worked. I don't know if everybody got a mask, but there was an unbelievable just like generation of effort and intensity. And there were Facebook groups and there was organization, and the tech team worked on a mapping system. And it was this thing that like Governor Polis made the decision to make this the thing we were going to do as Colorado. We weren't going to mandate it. We weren't going to demand it. We were going to ask people to give first and to give in wearing a mask and to then give other people masks. And we did it. And it was so amazing. And it to me really reflected what I think of as Colorado's sort of like ethos. And then the other thing I think has been really impressive is a view of Coloradans as the customer in the COVID experience, which I think a lot of times in government, we do a lot of work that is for our other government compatriots or for other agencies or, you know, local public health. We at the Department of Public Health might deliver to local public health agencies. But I think Governor Polis and other people in leadership, senior leadership, have really driven us to be delivering to Coloradans, and that they are our customer and we are in service of as government to them, to ourselves, to them. And I think that that's a really valuable and powerful place to be in the time of crisis, which is we all need to be working together. We all need to be doing our part, but also we are in service and we are viewing this as an important relationship that we want to deliver on.
And Sarah, you hit a little bit on, you know, the successes just now. And, you know, obviously, Brad, you mentioned it, we're very much still in the middle of this and working through this. But over the course of your time together, you know, what solutions are the two of you most proud of that you were able to, you know, come up with, iterate, innovate within this group?
Go, Brad. What do you have? I'll go after you.
Sure. I think that the data around social distancing and the collection of public data about movement of people, like CDOT data, that the team put together very quickly and was able to put systems together so that the state could start to understand and instrument things at a county level and understand the difference between 50% social distancing, 60% social distancing, 70% social distancing, and then subsequently build that into the models and make decisions about what to do. I put that one high on the list. I am very glad that we didn't get, I think some of the things we ended up deciding not to do or deflecting were just as powerful. There's a number of stories about states that early on got involved, spent a lot of money on technology initiatives like contact tracing, or not contact tracing, but exposure, what's now called exposure alerting, and didn't really understand the linkage between contact tracing and exposure alerting, and subsequently wasted a lot of time, money, and energy rather than focusing on things that could be effective, like the actual contact tracing, which was already a function that the state had infrastructure for. Like just being able to work through that, and instead of ending up being like, oh, well, here's the magic solution, 6 months later, exposure alerting is starting to emerge as a functional thing in some places. It's working well in Ireland. There's a handful of states that are starting to build on top of finally what looks like a platform infrastructure that is durable. But we didn't get tangled up in a bunch of, and the state didn't get tangled up in throwing a bunch of money at a bunch of wasted stuff. I think we created procurement dynamics where the research and investigation that we did probably saved a bunch of, well, certainly a bunch of time, but probably saved some money in a meaningful way that would have otherwise been the same kind of things that you're seeing in lots of other states with fraudulent purchasing activity, not by the state, but where they purchased things that were not available or didn't get delivered. And again, I think our interference on the front end of that, I think that's probably the right word, just being a buffer across that and trying to figure it out and getting smart about it would be another one. Another is, I think there are a lot of private sector resources and company type activities that private sector activities that the state had a hard time engaging with on the front end of this and really understanding, again, to Sarah's point, sure, ultimately the customer is a citizen, but there's also this structure called a business, and the business is not the citizen, but like whatever the cliche about political spending now with corporations, but you had all these other entities, and there was a lot of confusion, especially in the first 4 to 6 weeks. And we had a couple of people that were very, very active at navigating between and across those and generating information. That, for example, activity at some of the university labs in the state, the linkage between some of that activity and some of the state level activity, good understanding, by the way, of testing and testing efficacy. I remember there was a huge press of people all of a sudden to do antibody testing and how antibody testing was, going to be the solution. And I remember a conversation where my response in our conversation on our stand-up was, this is all bullshit. Like, we need to make sure we understand that nobody has any idea what any of this means. And there is no understanding of the immunology of disease. I'm not a disease specialist, but like, layman knows that this is nonsense, and we need to be really careful not to go spend a whole bunch of money on a whole bunch of things and spin up a whole bunch of stuff around antibody testing that efficacy doesn't work. We ended up learning words like specificity and sensitivity, and figuring out, being curious why the epidemiologists and the biologists don't just use false negatives and false positives and as a phraseology, figuring that stuff out. But I think early on we helped sort of a bunch of people who were not scientists understand and be able to navigate through that world. So you didn't end up having a bunch of policy activity independent of the science, but that was moved by what a lot of the noise level was sort of in the public space.
Well,
those would be some of mine.
Yeah, I think that there are the antibody test one is also stands out in my mind because there was a moment where Great Britain, or maybe just England as a part of Great Britain, had purchased something like $100 million worth of antibody tests, and they were going to deliver them, and everyone was going to be able to buy an at-home finger prick test, and it was going to be like the equivalent of a pregnancy test, and you'd know if you had COVID or not. And like, there was a moment where we were like, there's not enough testing in the world, we can't get there, is this the solution? And via the great structures and the incredible private sector expertise, as well as the in-state stuff, we were able to stand back and be like, no, this is a terrible idea. There's nothing, there isn't a there. We've got to let the science move much more quickly. And then the function of this incredibly robust, knowledgeable team that was in support of the state to sort of bat down all of that and be like, no. So that, to Brad's point, I did a study one day, and at the height of things, I was getting more than 100 emails an hour, 24 hours a day. And so just like the inbound was insane, and that was to everybody in the IoT and senior leadership at government. That's all of our executive directors of all of our state agencies, all of the county commissioners, that volume was heading at everybody. And so just to have that be absorbed in collaboration with somebody else was really powerful. On The other thing I think is an incredible success in that we recognized we didn't need to stand up a huge enterprise is that we had this initiative around telemedicine and really interesting ideas. And there's a lot of startup activity and there's a lot of cool stuff on telemedicine and telehealth and telemonitoring. And in this process, what we realized is that there is a natural and robust state agency that manages that, and that's the Office of eHealth Innovation, and they do exceptional work. And we didn't need to stand up a whole second engine to do all this work. They were the people, and we needed to be in service to them, and that was great. And we were able to launch some very cool pilots. So one of the pilots I'm very excited. Another thing is we've done a lot of pilots, and one of them is we have a remote telemonitoring learning collaborative, it's called, which is where we've equipped primary care physicians with a device that's an internet connected pulse oximeter, thermometer, does blood pressure monitoring, and we're evaluating if people can stay home longer and not need high level emergency care. And is that a really low cost solution that we can equip a lot more Coloradans with so that we don't have to hospitalize so many people, or so we can determine if they decline very quickly. So that was a cool one. We're also doing a pilot with Kinsa thermometers. They are at-home thermometers, but we can get early leading indicators. And so to sort of circle back to Brad's first one of the things I think might be underestimated as a challenge of COVID is that we don't have any leading indicators of what's happening. Everything is a lagging indicator. By the time we have test results, people are 7 days into the course of their illness. By the time we get contact tracing complete now, it's even longer. And by the time somebody's hospitalized and we get that data, it's weeks later. And so everything is sort of, I think the governor has described it as the ghosts of indicators, that we're just like chasing ghosts out here. And so the work I'm most proud of in the innovation response team are those that drove towards better indicators. We're not yet at leading indicators, but we're not lagging nearly as much as we could be, whether it's through the mobility data or through these pilots around detecting sort of clouds of fever rapidly. That we cannot underestimate the power of that, and in the ability to then make meaningful policy decisions, because our leaders need the best data they can get to make these decisions. It is not a decision to be underestimated to close down an economy. Like, that's an incredibly risky thing, and balancing the killing an economy versus killing people is the devil's bargain, and we need to get ourselves out of that. And I think the innovation response team was really oriented around not picking either of these in the devil's bargain, but what is a third way?
I want to add two more things that I think Sarah prompted me on. One of them, just going back to the antibody thing, somebody listening, they say, well, how did you make that decision about the antibody thing, that it was, not a thing? And the answer was, we didn't. What we did was we have big networks of people in the private sector that are experts at this. And in Colorado, especially, we have a bunch of biotech companies, and we, the network that we have, we know the CEOs of those companies and some of the lead scientists of those companies. And we were able to very, very quickly in the private sector reach out to folks. Again, they all wanted to help and ask questions and say, what is this? And is this something we should care about? And it wasn't that we then had to read hundreds and hundreds of pages and actually understand it, because it was unfolding in real time in a lot of cases. But a couple of these people could synthesize it. And when, 4 of the smartest people in life science, drug discovery research, who may not be focused on COVID and the COVID disease state, but can certainly read the stuff that people are writing from a scientific perspective and have a point of view and interpret it, all kind of come back and say, nothing over here. That can be done really, really quickly in the private sector with credibility. And then, that can be sort of transmuted back to Sarah and team as, here's a package of data that we believe is credible. Now the state decides whether or not they agree or not. That's not, there's no decision-making rights there again, but it's the ability to very rapidly get clarity around a number of things. I use that as an example. There are probably 30 or 40 things like that over the course of the 45 days, where we would reach out to, different people on the team would reach out to people we knew. I was on a national, or I'm on a national task force that I'm one of the advisory members of, that's very, very deep in all of the contact tracing and exposure alerting technology. And the people leading this and on the task force are some of the leading technologists across the country at major tech companies. And so the amount of information that was synthesized from that was very clear. And by the way, for people that care about the technology, at the very beginning of this, initially all the technology people started referring to contact tracing, because the technology people had absolutely no idea that there was already a thing called contact tracing that existed within government for infectious diseases. They, just didn't know. So, oh, well, you can keep track of who your contacts are. That's contact. And in fact, at the very beginning, there was confusion because some people call it contact tracking and some people call it contact tracing. Well, it turns out there's this thing called contact tracing. So then the technologists, being the smart technologists that they are, said, oh, well, we'll just differentiate it. We'll call it digital contact tracing, which just made it even worse, because then all the epidemiologists and all the historical contact tracers and all the people that were infectious disease specialists like, what do you mean digital? Like, we have a computer system here. Like, what are you talking about? And then, of course, Apple and Google come out with a big announcement about what they're going to do with digital contact tracing. And thankfully, one of the people in this mix, Harper Reed, who is a longtime, well-known sort of visionary CTO technologist, and a couple of others of us were on a call, and we're like, we got to change the language. Like, we're screwing everyone up. And I think this ran its course in, Sarah, you might remember, but in a week. And at the end of the week, it was initially exposure alerting, and now I think it's broadly called exposure notification, but it doesn't matter, right? But the point was the language mattered a lot. And I give one example of the collision between tech and government healthcare. There were endless collisions like this that were happening across our world, not just in Colorado, but our world around these kinds of things. And I think the group that we were involved in played a part in, for the state being a laboratory of a bunch of people, or a experimental team of a bunch of people who we bumped into a bunch of these things really early on, that then allowed there to be some clarity on where to focus and where not to focus. And we definitely had days, Sarah and I remember it, where we felt like kind of everything we were doing was of no value. It's like, we're bumping into things all the time that, you exercise them a little bit and you're like, this is dumb. This is not going to help. This is going to get in the way. This is not going to work. But with the benefit of hindsight, there was a lot of value in that, because it saved a lot of people in the state a lot of time not having to wrestle through those things. So I'm proud of that.
Me too.
Great. We've got about 10 minutes left here, and I want to shift gears and I'll grab an audience question for this one. But looking outside of your work with the state, looking at your own individual businesses, first off, what has this pandemic taught you about running a business during a pandemic? And second off, how much were you each able to focus on your own businesses, given all the work you were doing with the state? And Sarah, why don't you lead us off?
Oh, it's a hard question. I think I feel very much that this is a moment that I can't say no to, that I need to deliver for Coloradans and for the world on the public health side. And so I'm doing that more than I'm focused on building a company. But I think some of the things we learned I learned, and I'm interested, I will say that I am sort of really narrowly focused on COVID. I now am the lead for the state of Colorado for testing and containment. So I have a very specific portfolio, but on the business side, I think it's an interesting lesson, and I'm looking forward to learning sort of what the freewheeling attitude about cash becomes in startups. Is there any lesson to be learned about burning cash to grow at all costs? And is paper money, whether it's through valuation, are we in a different phase, and do we learn something different here, which is providing meaning and triple bottom line companies and those sorts of things? I also think that we cannot disconnect the moment of COVID from the moment of structural racism, and Black Lives Matter is being identified as the largest protest movement in US history. And it is inextricably linked to this moment of COVID. And I think that asks a lot of questions of startups, of venture capitalists, of capitalism, period, and the way we do business in the United States, which is how do we do it in a way that doesn't marginalize people of color, women, people with disabilities, and how do we do it in a way that doesn't drive people, whether it's through the gig economy or through just low wage work, to their absolute end threshold. And so how do we build more resilience into our systems? I believe very strongly that this won't be the last pandemic of our lifetimes, likely. As we know from what the climate projections are around climate change, we are facing incredible peril. And so I think getting our hands around how do we have a little extra give in our systems, whether those are our family systems, our individual systems, our venture capital and startup systems, how do we have some resilience and some resources on which we can draw when things really get stretched to the breaking point? I also think it's a really important and interesting lesson as a startup founder. I fought several investors on having full benefits for all of my full-time employees. And it was important to draw employees as an early stage startup where we couldn't match the salary to at least have healthcare benefits. And I think as we're facing the world's greatest pandemic at the same time in the United States, we have an unemployment crisis where people are getting kicked off their employer-based health insurance like crazy. Like, what does that mean? And as a founder, what do you do to ensure your employees have a safety net? And what is your responsibility as a founder?
I have grown to despise the phrase new normal because I don't think there's such a thing. I think we are in the midst of multiple crises. Those crises are the health crisis, which generated an economic crisis, which is generating a mental health crisis. And in the US, that has amplified a racial equity crisis. These are not new crises. They're crises that ebb and flow and have been going on, in the case of the racial equity crisis from the inception of our country. Economic crises run in cycles. Health crises. I'm in my mid-50s, so I remember HIV and AIDS extremely well because I was in college, and it definitely had an impact on my behavior and my understanding of what was going on and my feelings around a variety of things during that period of time. And I think that this is the collision of these crises. I just wrote the book that I came out with today, The Startup Community Way, builds on the idea of complexity theory and complex adaptive systems, and the notion of complex systems as the way that startup communities grow, develop, and evolve. And it would never occurred to me when I was working on the book 2 or 3 years ago that it was going to come out in the middle of the greatest collision of multiple complex systems ever in my lifetime. Like, the book is about what's happening right now. And even the language, the word contagion is an essential part of complexity theory, both positive and negative, feedback loops, phase shift or phase transformation, where things look a certain way until someday, and then they look totally different the next day. And you didn't sort of see all the little things sneaking up on you, and then all of a sudden they had radical change. Sarah mentioned telemedicine not too long ago. I mean, telemedicine made 10 years of progress in 4 weeks. The technology's been there, the infrastructure's been there. The incumbency dynamics have prevented it from happening. And not just incumbency where people didn't want to do it. And doctors said, oh, it's not telemedicine. I really need to see my patient in person. By the way, if your patients have COVID, you may not want to see them in person. Or if you're afraid of COVID everywhere, you may not want to see your patients in person. Or if you're a doctor that does certain types of elective surgery that's now been completely shut down, you can't actually see your patients in person. But then on the other side of the equation, the federal government just got out of the way. Oh yeah, you can do, all these 19 different things that previously you had to buy, like super expensive software that was HIPAA compliant and do all this and that. We're waiving all that stuff for now. And yeah, you can do telemedicine with Skype. And in 24 hours, it just completely changed the dynamic. So I think we're in a phase where there's many of these things that are changing, that when we come out of this phase, we're not going back to where we were in February 2020. I think that's magical thinking, and I think that's unhealthy thinking. I think, for example, the entire global real estate industry should not expect that when COVID will end one day and everybody will go back to their offices and it will all be like it was before. Right? Not going to happen. And oh, by the way, why do you live in the middle of, on the 32nd floor of a building in the middle of a city in your 1-bedroom apartment when you can move to Carbondale and have 3 acres and a house? And you may want to live in the middle of the city, and that may be what you want, but if you're living there right now because your employer is telling you you need to live there because you need to be close to work, and that's not really where you want to live, all of a sudden there's lots of things that change. And interestingly, Colorado as a state is in a really strong position, both functionally and economically, for that kind of a global shift in behavior of humans. I can't predict where that behavior is going to go. It's going to be all kinds of different things that emerge as a result of the collision of all these complex systems. And that's the moment I think we're transitioning through for whatever period of time, and it may be a long period of time that we're involved in this crisis.
I want to close us out here with one last question, a forward-looking question from the audience. And the question here is, can the panelists speak to 1 or 2 challenging scenarios you are better prepared to meet in the case of a resurgence in the fall by using the experiences you've gained over the last 4 months?
I will absolutely start with that. We are in such a different and better place as it pertains to testing. We in Colorado were in the early days testing, I don't know, this was before I became involved, 100, 150 people per day, and 25 or 50% of those tests were coming back positive, and it just increased from there. And we have in Colorado, through the learnings we've had in multiple areas, but especially the innovation response team, increased the resilience and we have removed our dependency on the federal government as a supply chain solely, and 2 primary national labs to do our processing. And we have created a structure that gives Colorado a much more robust and resilient system. And I feel so much better moving into respiratory disease season or flu season with that sort of new model. I also feel a lot better just by having some time and knowing about this idea of learning more and more about the virus and the complexity of the disease is so important and helpful, because it isn't just a flu. We know that it causes this micro clotting that causes all these catastrophic organ failure problems. And so I feel relieved to know more about the disease. That is also, I will say, one of the things that keeps me up at night, is that we, as we're getting better at treating it and helping people, we are facing an incredible and challenging long-term health crisis, which is how do we support all of these individuals who might be on oxygen for the rest of their lives, having their limbs amputated, young people having their limbs amputated as a result of COVID. Like, this is a complex and catastrophic set of outcomes. And so I think I don't underestimate that. So that's sort of a little of good and bad. What about you, Brad?
I have a couple of immediate reactions. One is, I understand that flu season starts in the fall, and we have this phase of that. But I think actually the question itself, well, I like the question. I appreciate the question. I think it's there's a meta, which is part of the challenge, which is we are in a resurgence. We never had a non-surgence. The delay is the thing that's so hard. I remember when, states started opening up and caseloads started increasing, and there's lots of controversy about, well, we're getting lots more caseloads, but the death count still stays low. Like, yeah, give it 3 or 4 weeks, right? Because oh yeah, we got plenty of ICU bed capacity. Give it 3 or 4 weeks, because there's a delay. And we don't know how to process intellectually as humans that delay. And there's delays not just in one part of the cycle, there's delays in multiple parts of the cycle. And so I think that the cause and effect dynamic that we're dealing with right now, thing I've learned is how challenging it is for people to process the cause and effect dynamic. And in some ways, for example, the number of tests, the number of positives a day is not an interesting. I mean, it's a number, but it's not the interesting number. And I think the state has done a really good job now of saying what they're managing to is ICU bed capacity, right? So they understand the metric that they're managing to. And then there's a whole bunch of numbers, positivity rate, things like that, rate of change of hospitalizations, length of hospitalization stay. Oh, by the way, the treatments of COVID in April, nobody knew what to do. So you showed up in the hospital with the 50% oxygen level and they shoved a ventilator down your throat and pretty quickly learned that for most people that kills them. So that's not a very effective treatment strategy. They have a much better treatment strategy now if you show up in the hospital. For some people, the answer is you need a ventilator. For a lot of people, you need other things. And it's not magic and it's not guessing as much anymore, back to Sarah's optimism. And that's good. We've had some time to learn. But the pessimism is we so want a solution. We so want that vaccine that, oh, the vaccine's discovered. Okay, great. So how are we going to get 300 million people to get a vaccine in the next 2 days? Like, that's not going to happen. Oh, by the way, the vaccine only lasts for 3 weeks and you got to do it twice. And oh, by the way, yeah, the vaccine sort of works for 60% of the people. And if you don't have these things, it doesn't. Like we're so hopeful that there's an answer. And I think the resilience of us as humans, we benefit from not worrying about the magical answer and instead really understanding how the systems work and working together to operate effectively within this context. And I'll end on optimism versus pessimism. Like, here we are in the middle of July, and I think there's a lot of people in the state government in Colorado and a lot of people throughout Colorado in the private sector who are so much better prepared, so much better educated, with so much better resources and an understanding of what's available and what's not available. I mean, just I'll lock down on Sarah's comment on, dependency on the federal government for testing turned out to be a no-op. Like, doesn't work. Be nice if our federal government did that well. Doesn't. Okay, well, let's go solve our problem. And, given the hard work of a whole bunch of people in the state, we don't have that dependency. True on so many different things. And, it's going to keep evolving. Last comment I'll make here, and, people probably have on their mind school, right? Having kids at home and doing remote learning, which, whether it works well or doesn't work well is irrelevant. Like, or it's not irrelevant, but it's a piece. The idea of school starting up and being just back to normal in the fall is not, maybe it's not a 0% chance. It's pretty close to zero. And so the flexibility and adaptability, and again, I'll use the word resilience, that we have to have as individuals against that context and helping each other navigate through it, I think is super, super important, because it's just not going to magically get better.
I know we're over time, but I want to emphasize that what Brad just said, which is I encourage you all who are participating in this to do some reflection about where you are and what your sort of like magic bullet or magic solution is. I know some people are like, in 2 weeks, I'm going back to work. I'm going to be in the office, or in 6 weeks, my kids are going to be back in school, and try to do some work around assuming we're in this for a really long time. I had to come to some places where I feel like until January 2022, we're in this, and it's not going to look dramatically different. And when it does look dramatically different, it's not anything like I can imagine now. It doesn't look like what it used to. It doesn't, like, it's a whole new world that we're moving towards incrementally, and there will be no magic bullet. So find your own self peace with that. Otherwise, it's bad for your brain and it's bad for your body. It's that constant cycle of.
That's such an important point. Like, yeah, of course there could be a magical thing. If you count on that or you anchor on that, that's where the unhappiness comes from. If you understand yourself and understand what you and your family and your friends and the people around you need. And again, especially with your own self-reflection, we can navigate through this regardless of what the ups and downs are. It's when, you know, you hit a moment in time where you're like, damn it, I expected X, and since X didn't happen, now I'm miserable. If there's enough of those situations, that's where the mental health crisis comes. That's where it folds back on you. Really well said, Sarah. I agree with that. Totally. Good ending.
Well, great. Thank you both. I really appreciate all the insights you shared with us today. Yeah, thanks again. Before we go, I just wanted to say, in Inno's case, one of the reasons we've been ramping up our expansion is because we've learned that the more markets we're in, the better we can serve our local communities. So if you're a logistics company here in Colorado and you want to connect with a logistics-focused VC firm in Tampa or Austin or DC or one of our other markets, we're here to facilitate those connections. So beyond telling the stories we tell and hosting the events like this, we're also in the business of making connections. So reach out to us if we can help in any way, if we can make a connection in one of our other markets. That's one of the reasons we're here, and that's one of the reasons we do what we do. And like any company, we also rely on our user feedback. So if you've got feedback on this event, on our stories, on our newsletter, don't hesitate to reach out. We're always striving to learn more and be better in everything we do. So Brad and Sarah, thank you again. I really appreciate it. Everyone who attended, thank you again. And if you haven't already, sign up for the Beat, and we'll see you in your inbox tomorrow afternoon. Thanks, everyone.